from Double Health USA. So David, thank you very much.
Good afternoon, everyone. Okay. Oh, there we are. Oh, okay. Thank you. Good afternoon, everyone. My name is Dave Key, and I'd like to give you a little idea of what we do, and very similar to what Dave Baum had said. We're also an insurance agency, but we have kind of want to give you a little idea of what our philosophy is with this thing. First, we want to make sure we understand the environment. It's changing quite a bit. I think things like Medicare prescription drugs will probably get more changes as we go along. We want to make sure that you understand the products that are out there. We've had a little description of them. Once you get in details, there are a lot more things that you have to know. We want to make sure we understand the client because it really, one of the things that I've learned is that what I think is the best is not always the best for what somebody else may think, because there are different frames of reference that everybody has. And then once we have that, we want to make sure that we educate the client so that you have a base understanding, because it really is your decision when it comes down to it. We can give you the ifs, ands, or buts and things like that, but in the end, it has to be your understanding of what you're getting, and it can be a little complicated. Then we like to work with our clients to make sure that you have the best choices that for you in the way that you look at it. We also assume that problems are going to occur, because they usually do. Not for everybody, but we work on the Murphy's Law principle that something will happen. And we want to have these problems solved as quickly as we can. And finally, we need to respond to changes in the environment so that these changes, as they affect you, that you will be able to let you know and work with you again so you can stay on top of it, make sure these plans really truly cover your needs. Well, what is Double Health USA? Well, again, we're a national insurance agency, consulting organization, and we're based in Michigan, so we're local. So we do house calls if necessary, or we can do things over the phone, however we need to. And if you're in other states, we can usually do things over the phone pretty easily. But we're appointed with a number of companies in Michigan and other companies, almost all of the major companies in Michigan we represent. So we don't have a vested interest in one or the other. The vested interest is in you. We're licensed in about 33 states. And my experience is that I actually worked for Blue Cross Blue Shield of Michigan for over 22 years as responsible for the Chrysler account and the Chrysler nationally. So worked for Chrysler for 22 years, and I guess I couldn't stop working for Chrysler. So once I retired, I continued to work with Chrysler retirees and other retirees as well. And so end up as kind of an insurance nerd with about 40 years in the insurance industry. So have a lot of familiarity with Chrysler even from the very beginning when they changed their plans to drop the retiree plans. We were involved with that, not making the decision, but helping Chrysler at that time with that. There are 4 examples of how we put this business philosophy into action, and we'll kind of briefly go over those. We'll just go over Medicare plans, changing your plan, prescription drug plans, and just dental insurance. You can see these little dials moving back and forth, and that's probably what always happens with this. For Medicare plans, again, we want to make sure you have a basic understanding of these plans, because they are different, and there are little quirks and things that are different for different people again. So one of the things that we do is that we have a PowerPoint presentation and actually a webinar that will be sending out, and I have the dates of those on my desk, and you might be receiving notice of them later. But that we found out if you can boil it down to 12 basic questions, and if you can really understand that, then you'll basically have an understanding at least of what these plans are and how they work. And then the other thing is that we have to, these plans they sometimes are neither good nor bad depending on what the client needs. And so we have to really understand what you need, what you want, what your situation is so that you can get the best from your plans. And then we compare different products, different plans, different companies, and then just work with you to find out the best decision for you. And we complete the application process, of course, and then we follow up with troubleshooting as needed. And if we're really in kind of a relational thing, so a relational kind of philosophy, so we will know what happened 2 years ago or 3 years ago and say, oh, this change or that change, or this is what we need to do. So as long as I'm around, you'll be talking to me, I suppose. The Medicare in 12 questions, the webinar, I won't go through these in a lot of detail, but what we found, again, there's 12 basic questions that if you know these questions, the answer to these questions, understand them, you can basically have at least a good running start. And I'll just go through them very quickly. You know, what is Medicare? What does each part of Medicare cover? A lot of stuff that you were exposed to today. What are Medicare prescription drug plans? What doesn't Medicare cover? And then we get to the 3 basic options that most people will take, and that what is original Medicare with a prescription drug plan? What are the strong points and weak points with that, or issues, I should say, with that approach or that choice? Then what is original Medicare with a prescription drug plan and a Medicare supplement plan? And then the strong points and issues with that approach. Then what is a Medicare Advantage program with prescription drugs, with or without, but this will, we go through again the weak points and strong points with this. And basically what we're doing, those are the 3 choices, and we kind of go through those, at least you understand. And it boils down to what this is going to be. Most people, 90% of people will make one of these 3 choices.
Oops. Let's see. There we are. And then, again, the Medicare features and that you should consider in your choices, and then what personal issues do you have. So that's basically how the process usually works, but it's different for, even though the same process, it's different results for everyone. Okay, changing your Medicare plan is another thing that we help with, and we've talked a little bit about that today. But first, we really, what we basically would start with is saying, well, what are the good points or issues you have with your current plan? Is because as a general rule, unless there's a reason to change, it's probably not just good to go out and just change. You may want to just explore. That's a good reason, but otherwise, I think that it's helpful to at least know why you're changing and what issues you have. And then reviewing these policies, medical underwriting does pop up in a lot of plans, for Medigap plans anyway. Where you decide to change, you do have to usually go through a medical underwriting process. Not always, but almost always you have to do that. And how that will affect you is different, and it's different with different plans. So you have to kind of look at what each plan, what their rules are, and see what that looks like. And then we have you need to have a clear understanding of what the issues you have that could affect it, especially your health issues. And we review the plan options, and then decide whether to actually apply. Medicare Advantage plans, Medigap plans you can change whenever you want to, has been previously said. Medicare Advantage plans, you can usually change them only during the open enrollment period, except you also have another period. I won't go through all the periods because they get pretty confusing, but there are a couple of other options for Medicare Advantage plans too that you can change. But basically, for most people, it's the annual open enrollment. And then comparing with existing plans and deciding whether you want to keep your plan or not. And then go through all the enrollment issues as well. Now, the Medicare drug plans are probably the things that are going to change the most in a lot of ways, just because drugs are getting so expensive. And what the first thing we'll do is, and as David said, is that we need to get a pretty comprehensive list of every prescription drug you have. You know, at the dosage, at the limits, everything like that, and especially the ones that are expensive. Yes, okay. And then we'll go through this. We basically, I'll just go through this a little bit, just one thing on this. We actually have we do it a very old school way. We actually go through the actual formularies with this. So we actually know that if a question arises, we know that it came from this formulary in this date. So if we have to contest it, we know what to contest. And then we actually will go back and review these things to make sure we have them, and we actually will go back and research this. But we go through in a lot of detail to make sure on prescription drugs. Okay, we'll skip dental insurance. You can see it's just frightening to have dental insurance, but big thing about dental insurance is get a treatment plan and then see if it makes sense. Okay. All right. Well, here I am, and here's my contact information. I have more of that in the table. I want to thank you, and just one other thing is that tomorrow we actually will have a little, we're going to try something a little different, and I have some information on the table. We'll actually have a conference call tomorrow with all the information you have, and if you're interested, it's open forum. We'll see what questions and answers that you might have, and we'll try to address those or at least refer those to you. Thank you.